DAPSA and MDA are tools for measuring disease activity in psoriatic arthritis. We are all familiar with ACR scores used as primary endpoints in trials for RA and PSA. But just as RA and PSA are different disease entities, there is a need for psoriatic arthritis-specific disease activity indices. DAPSA, which stands for Disease Activity Index for PSA, is similar to an ACR score in that it uses tender and swollen joint counts, CRP, patient assessment of pain, and patient global assessment. However, it is more tailored to psoriatic arthritis as it includes tender and swollen joint counts in the feet, since psoriatic arthritis is more likely to have lower extremity joint involvement. cDAPSA excludes the CRP measurement in the above calculation. DAPSA and cDAPSA are very joint-centric measurements. MDA, which stands for Minimal Disease Activity, is a tailored treat-to-target endpoint in psoriatic arthritis that is not as joint-centric. MDA has 7 domains measured, which does include tender and swollen joint count and patient's pain and global disease assessment on a visual analog scale, but also uniquely includes measuring tenderness of enthesial sites, measuring the burden of psoriasis by using PASI or body surface area, and includes a HAQ-DI measurement. To achieve meaningful improvement in MDA score, one must hit various targets of improvement in 5 out of those 7 domains. DISCOVER-2 is a randomized controlled clinical trial looking at guselkumab in bio-naive psoriatic arthritis patients with data spanning 2 years. MDA was used as a secondary endpoint in this trial. Treatment with guselkumab led to continuous improvement and minimal disease activity criteria, with significant proportions achieving near remission in swollen joint count, psoriasis area and severity index, and enthesitis. 25% achieved minimal disease activity on guselkumab Q8 weeks versus 6% in the placebo arm at 24 weeks. 40% of patients in the guselkumab treated group achieved minimal disease activity at 2 years. This trial used non-responder imputation, so patients with missing data or those who dropped out for any reason were considered non-responders. CORE-EVITAS is a psoriatic arthritis registry where we are able to capture real-world data and analyze it using cDAPSA in patients on guselkumab. Real-world evidence is a good follow-up to randomized controlled clinical trials and is more representative of our real-world patients we see in clinic. By design, there was limited inclusion and exclusion criteria, and the population was harder to treat in terms of a cohort. And they were predominantly bio-experienced, Caucasian, obese females. We found that 80% remained on guselkumab at that follow-up 6-month visit. Among those, there was a significant decrease in cDAPSA observed. Actually, 1/4 of patients who had moderate or high disease activity at baseline achieved low disease activity at that 6-month visit.